Okay, hi everyone. My name is Aya Hajj. I'm a student at McGill University. I study anatomy and cell biology. I'm graduating this semester, and I'm also one of Lamsa's ambassadors. So before starting, I'm just going to tell you a bit about Lamsa. So LAMSA stands for Lebanese Association of Medical Service Addiction. And LAMSA stems from the principle that we can't always cure, but we can always care. And LAMSA's mission is to foster evidence-based medical education and awareness on addiction, mental health, co-occurring physical health, and well-being issue. Its aim is to advocate for the destigmatization of those diseases and the implementation of effective and affordable strategies that will screen children, teens, and youth for psychological, mental, environmental, and other risk factors associated with addiction and unhealthy behavior. So LAMSA's main goal is to promote a sustainable and healthy community for the future by the youth and for the youth. So today I'm going to present to you a drug called Barbiturates. And so I'm just going to present to you a brief overview on what we're going to cover today. I'll give you guys a few seconds to go through it and then we can start. Okay, I'll start. So let's start with some facts about barbiturates. So barbiturates is a drug that produces alcohol-like effects when administering it. So if you ask me, how dangerous are barbiturates? If you put it this way, they were frequently used in the past for euthanasia, assisted suicide, or capital punishment. So euthanasia is the practice of intentionally ending a life to relieve pain and suffering. So since barbiturates were very lethal, Nazis back in World War II used to administer barbiturates to their prisoners in order to end their life. Also, tragically, there have been many famous people who died of barbiturates overdose. So you may know Jimi Hendrix, who died of barbiturates overdose, and his doctor gave the cause of death as inhalation of vomit due to barbiturate intoxication. And of course, Marilyn Monroe's death was a very mysterious one. She overdosed on barbiturates, and some may say that it may have been an accident or even foul play. So like many other drugs, barbiturates have a high potential for abuse and present a significant risk of fatal overdose. So this is why they have been replaced by benzodiazepine, which we are going to see at the end of my presentation. And yeah, that's it. So what are barbiturates? So, like benzodiazepine, opioids, and alcohol, barbiturates work by depressing the central nervous system. So they reduce the activity of nerves. How do they do that? They increase GABA activity in the brain. So what is GABA? GABA is a brain chemical that creates a sedating effect. So this will cause muscle relaxation, reduce heart rate, breathing, and blood pressure. So originally, barbiturates were given as a treatment for insomnia. And over time, the use of barbiturates expanded as doctors prescribed them to treat not only sleep disorder, but also anxiety, epilepsy, and severe migraine or cluster headaches. The thing about barbiturates is that the tolerance develops very quickly, possibly within the first administration. So this means that larger and larger doses are required for the medication to be effective. This is a significant problem because the therapeutic window, which means the dosage at which the drugs work but is not lethal, is very small. So first, such a rapidly manifesting tolerance play a very important role in the subsequent risk of abuse, potentially producing barbiturate dependence and the development of an addiction to the medication. Second, barbiturates use turns into abuse because higher dose cause the user to experience pleasurable euphoric effect. They will feel relaxed, happy, and less inhibited. Third, because of the specific mechanism of action that I will explain to you in the next slide, barbiturates create a great physical dependence and that is far more severe than with other drugs like benzodiazepines and opioids. So the withdrawal symptoms will be very fatal. So significantly, barbiturates dependence and the severity of the withdrawal symptoms are dose dependent. This means that heavier or long-term addicts will be far more affected than short-term or low-dose abusers. So now I'm going to explain to you the mechanism of action of this drug. So as you can see here, you can see the nerve, which is polarized, and you can see the protein channel, and you can see the chloride ions that are floating around. The chloride ions are inhibitory, so once they will pass through this channel, they will create the sedating effect. So now, what is the role of GABA, the neurotransmitter? So GABA will bind to this channel, open it, and let chloride ions flow in. Now, what is the role of barbiturates, and why do it increase it increase GABA's activity? So barbiturates will bind to this channel and keep it open for longer. Instead of having the normal amount of chloride ions that will flow in, we'll have even a greater amount. So this is why it will increase GABA's activity and increase the sedating effect on the brain. And then barbiturates will overwhelm the nerve, it will detach from the protein channel and disintegrate. So now, why are barbiturates prescribed? So barbiturates are a group of drugs in the class of drug known as sedative hypnotics, which generally describe their sleep-inducing and anxiety-decreasing effects. So they are used to treat anxiety and sedation related to surgery, if other drugs didn't work, insomnia, seizures, anesthesia, tension headaches, or even traumatic brain injuries. What are the forms of barbiturates? I'm just going to remove this noise. Okay. So, okay, what are the forms of barbiturates? Okay, so barbiturates are available in injectable, liquid, tablet, and capsule. They come in many different strengths and combination. What are the side effects? Okay, so what are the side effects? Okay, barbiturates have a very narrow therapeutic index, meaning small difference in dose can result in big difference in the effect of the drug, and patients can easily develop side effects. Combining barbiturates with other drugs such as opioids, benzodiazepine, antidepressants, or over-the-counter medication with antihistamine could be fatal. And the side effects are rare but very serious. It's difficulty breathing, chest pain, tightness, rash, fever, joint pain, swelling of the face, lips or throat, and unusual bleeding or bruising. Now, what are the risks of taking barbiturates? Barbiturates, like I said before, have a high potential for abuse, and prolonged use can result in tolerance and physical dependence. A person with an increased tolerance will often seek a higher dosage in order to produce the desired effect, and this may result in dependence and addiction. Frequent barbiturate users may experience severe withdrawal symptoms within 8 to 15 hours of stopping the drug. Polydrug use, which refers to the use of combined psychoactive substance to achieve a particular effect, has long been associated with barbiturates abuse, and barbiturates have historically been a secondary drug of abuse for people who misuse alcohol and heroin as their primary drug of choice. So co-administering barbiturates with alcohol and opioids like heroin as well as benzodiazepine increases the risk of overdose significantly. So barbiturates have an additive effect on the substance, and consuming them in conjunction with one another will produce very undesirable effect, and it's very dangerous. And also, barbiturates are very dangerous for people who experience, who have a severe respiratory disease or kidney disease. Now, what is the pregnancy risk when taking barbiturates? This is the most interesting part of the presentation for me, because you will see why. So barbiturates have been shown to increase the chance of birth defects in humans. However, this medicine may be needed in serious diseases or other situations that threaten the mother's life. So taking barbiturates regularly during pregnancy may cause bleeding problems in the newborn infant. In addition, taking barbiturates regularly during the last 3 months of pregnancy may cause the baby to become dependent on the medicine. So the baby, after he's born, may experience withdrawal symptoms. So he didn't even take the drug, the mother did, and he is now experiencing withdrawal symptoms. So one study in humans has suggested that barbiturates taken during pregnancy may also increase the chance of brain tumors in the baby and respiratory problems. Barbiturates also taken for anesthesia during labor and delivery may reduce the force and frequency of contraction, and this may prolong the labor and delay delivery. As for breastfeeding, barbiturates can pass into the breast milk and may cause drowsiness, slow heartbeat, shortness of breath, or troubled breathing in babies of nursing mothers taking this medicine. The withdrawal symptoms. So barbiturates may cause death if suddenly stopped. So the reaction severity depends on a person's overall health, age, or other health condition they may have. And so some withdrawal symptoms include nausea and vomiting, hallucinations, seizures, delirium, stomach cramps, depression, anxiety, restlessness, and all these undesirable side effects. Now, the legal issues that surrounding barbiturates. So barbiturates they are still used legally in the hospital for anesthesia, sedation, traumatic brain injury, and they are sometimes still prescribed for headaches if other medication didn't work. However, there are some people who still try to take barbiturates illegally. But what they should know is barbiturates are a prescription-only drug under the Medicine Act. This means they can only be sold from a pharmacy in accordance with the doctor's prescription. Barbiturates are also controlled as a Class B drugs under the Misuse of Drug Act. So doctors can still prescribe them and patients take them, but unauthorized possession or supply is an offense. So the maximum penalty is 5 years imprisonment and a fine for possession, but 14 years imprisonment and a fine for supply. So also if it is prepared, if barbiturates is prepared for injection, it is regarded as a Class A drugs and has even more severe penalties. So illegal use has led to an increase of overdose deaths because the medication is very dangerous for self-treatment, and they are still used nowadays in many countries because they're less expensive. There are some people who even try to procure barbiturates on a black market online, but these barbiturates will come with even a greater risk because they might be expired or contaminated with other substances. Now, what is the sign of an overdose? And this is not only specific to barbiturates, but to any kind of overdose. So a person who will experience an overdose will feel extreme drowsiness, trouble speaking, extreme weakness or tiredness, slow breathing, confusion, trouble with coordination and balance, very slow heart rate. They might even turn blue and they will experience a drop in temperature. Now, is it possible to reverse a barbiturates overdose? The treatment of barbiturates toxicity remains supportive as there is no specific antidote for overdose. The first step in treatment, as with any overdose, is assessing the patient's airway, breathing, and circulation. So with significant sedation and respiratory depression, intubation and mechanical ventilation may become necessary. Early treatment with activated charcoal may be useful to remove the excess drug from the body and can be given via a nasogastric tube. Patients will likely need to be admitted or observed, and during the recovery, the patient should receive counseling about the dangers of barbiturates misuse. Other options for managing barbiturates toxicity include forced alkaline diuresis and hemodialysis for really severe cases. And doctor can also administer to the patient a drug called bemigride, which is a central nervous system stimulant, so the contrary of barbiturates, and will increase respiration and can be used as a treatment for depressant toxicity. However, there is a concern about it because it's an emetic and it might cause vomiting to the patient. So it's really also for severe cases. Now, I talked about, I'm sorry. Now, how do barbiturates compare to benzodiazepines? I talked in my presentation about benzodiazepines, and we'll see why the barbiturates have been replaced with benzodiazepines. Now, the biggest difference between barbiturates and benzodiazepine is their fatality rate. So there is many people died of barbiturates overdose. We have many records of it, but we have no record of people dying because they only took benzodiazepines. So this is the biggest difference between them. But however, they have the same effect on the brain, there's the same side effect, the same withdrawal symptoms, and the same mechanism of action on the brain. So they both create a sedating effect on the brain. So now I'm just gonna do a summary of the key points of my presentation. So barbiturates, they became popular from the early 1900s to the 1970s, and there were few medication options to treat seizures, anxiety, and insomnia. Doctors stopped using them because when misuse and overdose increased over time. Barbiturates have limited use today, and safer medication are available, like benzodiazepine. However, barbiturates are still being misused today, and the risk of overdose deaths increases when they are in combination with other medication like alcohol, opioids, benzodiazepine, and other medication. So barbiturates need strict monitoring because of the risk of overdose and should never be taken without the doctor's supervision. I also organized the take-home message with the key points of my presentation, and if you guys are interested, you can screenshot this slide and keep it in your files. And that's it. I'm just gonna give you a moment if you want to screenshot it. Thank you so much, guys, for listening to my presentation. I hope you like it. And if you have any question, you can put it in the chat and I'll do my best to answer every question. Thank you.